Assalamu alaikum, sir. It's me, Bilal here.
जी। माइक म्यूट कर लें, जो लोग जिनके पीछे शोर है वो अपना माइक म्यूट कर लें।
यस भाई, मुझे कॉल आई है डॉक्टर साहब की, तो मैं दोबारा उनको कर रहा हूँ आपको कॉल।
Assalamualaikum. Azhar, can you please start the webinar?
जी अस्सलाम वालेकुम सर।
Can you please start the webinar with recitation of Holy Quran?
यस प्लीज। अऊज़ु बिल्लाहि मिनश शैतानिर रजीम, बिस्मिल्लाहिर रहमानिर रहीम। अलम तरा कैफ़ फ़अल रब्बुका बिअस्हाबिल फ़ील, अलम यजअल कैदहुम फ़ी तज़लील, वअरसल अलैहिम तैरन अबाबील, तरमीहिम बिहिजारतिम मिन सिज्जील, फजअलहुम कअस्फ़िम माअकूल। सदक़ल्लाहुल अज़ीम।
Thank you, Azhar. Please initiate the webinar proceedings. Azhar, please initiate the webinar proceedings.
ये सर थोड़ा फाइल कनेक्ट होने में मुझे लग रहा है टाइम। बेसिक हम और स्टार्ट करें।
आप connect
मैं
करो.
बिल्कुल
I
तैयार
will
हूँ।
start the video presentation. आप इतने connect करो. I will
ओके
start the video. Okay.
जी 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 प्लीज
Okay.
थैंक यू।
Please explain then what it is. Sure. So I'm sure you guys have heard of PRP, platelet-rich plasma. That's taking a little bit of blood and then putting it through a centrifuge, spinning it down, taking the PRP and injecting it into the skin. However, there's something that's even better. So with MCT or meta cell technology, this treats your PRP with light and temperature to really amplify the growth factors in your skin. This can also grow your own exosomes to 299.6 billion per ml.
Well, here in clinic, we actually have two ways that we can do that. So number one is using our MCT PRP. This is using a very specific machine that after we collect your PRP or your platelet-rich plasma, it's going to stimulate your platelets to release your own exosome. So this is a totally different, it's like an amped up PRP technique that very few clinics are using.
Assalamu alaikum ji. I am Dr. Nasser, President of Hair Club. First of all, I would like to welcome all the participants that we feel appreciated that you spare time to join us. Uh, the webinar today is basically on the latest treatments and therapies which are now available for treating male pattern hair loss or any kind of hair loss. So first of all, the main awareness program is that besides hair transplant, there are some other treatments also which are effective in some patients, not in all patients, but in some patients. So one of the most advanced and most popular procedure that is happening now in the world is exosomes. And there are different confusions and misunderstandings about the exosome treatment. um, Exosomes basically are stimulating cells like growth factors, which actually repair the damaged tissue or which rejuvenate and regenerate weak cells of the body. So there are three kinds of exosomes. One is derived from plant; their source is plant. The other type of exosomes, they are animal derived, like they come from different species of other animals. And the most latest and most advanced type of exosomes is which is extracted and developed and processed from patient's own blood. So this is called metacell technology. Abbreviation is MCT. Metacell technology is a very advanced form of exosome extraction system. The main benefits of this system is that there is no foreign body being injected into your own hair or scalp hair roots. In case of other types of exosomes like plant-based exosomes and animal-based exosomes, they are they are coming. Their source is a different individual or a different source. They are not coming from your own body. So there is always a risk of allergic reaction or any side effect or any sort of irritation that your body might react to it or your body might reject. Although it's a very small probability, but still there is a probability. So being the leader in the industry, Hair Club has introduced this most advanced and most safe technology, which removes the need to depend on plant-based or animal-based exosomes. So with the introduction of this MCT technology, which is called metacell technology, we don't need to use plant-based or animal-based exosomes. We take your own blood, just like PRP, and we can take 20 ml blood or 40 ml blood, depending on the area that we need to treat. And then we use this machine, um, which actually extracts and separates your own exosomes from your blood and makes a concentrate liquid um, with the use of its technology. And then those exosomes are injected into your thinning hair or into your balding areas. So the other benefit is that all the plant-based and animal-based exosomes that are presently available in the market, their strength or their concentration normally ranges from 10 billion, 5 billion to maximum up to 70 billion. Very rare, very few products are above 70 billion. The maximum highest concentration that is available in the market is 100 billion. But this metacell technology, which is extracting exosomes from your own blood, it creates a concentration of minimum 200 to up to 300 billion, which is almost 2 to 3 times the highest concentration available in the market of exosomes which are coming from animal or plant source. So before we move on to the question and answer session, and before we move on to other uh, aspects of this technology and who are the ideal candidates, this is not for everyone. We have to do a patient assessment, and we have to find an ideal patient who is a good candidate for exosomes. Because if you have a very advanced form of hair loss, then exosomes alone might not help. Then you need a hair transplant, and then after the hair transplant or before the hair transplant or even before and after, you can get exosomes, but you definitely would need a hair transplant in some cases. So Azhar, I think your presentation is ready. Please take it to the start of the first slide, and please initiate the
Yes.
main presentation. And then once you finish, then I will take over for the question answer session.
Okay, great. So thank you very much. Welcome on board, everyone. Thanks for joining us. for having like basic information regarding the possibilities and the latest innovations which are available in the market for having like hair loss prevention and hair restoration, right? Basically, first of all, let me introduce Hair Club. Hair Club is a pioneers of the industry. मतलब it started as its business from like 1996 onwards, 93 onwards, and then currently we are having like a network of branches pan Pakistan, and we are offering like consultation services all across the world. And we are having like a highest qualified hair transplant surgeon, Dr. Muhammad Nasir Rashid. He's a principal hair transplant surgeon, he's a diplomat American board and fellow ISHRS surgeon, right? And got like highest degree and highest education, prestigious education in the relevant field. And he's one of like a few hundred surgeons all across the world who got like a fellowship of International Society for Hair Restoration Surgeons, right? And having like experience of more than 25 years in doing like hair restoration. And we had treated like all the famous celebrities, sportsmen, doctors, engineers from all across the world, basically, right? And first of all, I would like to tell you about the possibilities. Basically, hair loss is a genetic problem, and it runs in families, and the possibilities of getting hair loss is quite obvious in started from like mid-teen ages and continue getting like further baldness till age, right? 40s till 40s. DHT is the main cause of getting like hair loss in males, and it should start receding from like temporal regions and gradually growing backwards. Or some people does have like thinning from the crown area. Some people does have like diffuse hair loss from all over the top, right? The top hair are basically non-permanent hair. With age, normally people used to get like baldness, and there are a lot of causes of hair loss, but mainly it is genetic. It runs in families either from father side or mother side. Even with age, they got like baldness, so that means you can be the potential candidate of getting like hair loss with age, right? So hair loss is a chronic disease, and it doesn't have permanent cure. But again, treatments, latest innovations are available which can help better retention of your weak hair, that can help to slow down further process of hair loss for the future. If you start using treatments earlier, so you are going to get the benefits to prolong the life of your existing non-permanent hair for a longer time. But again, continuous regular treatments and good combinations are really effective for better retention. And the frontal zone doesn't respond to the treatment much, but with the vertex area, the crown area, the top part is having like more receptors which are DHT matlab, sensitive, and that responds to the treatment much. So that's why in the earlier stages of hair loss, the treatments are really effective. But regular use of medications along with the combination of clinical therapies like stem cells, exosomes. Exosomes nowadays is a very popular, as Dr. Nasir explained it well. That is going to be the best option for getting like clinical treatments. But again, apart from clinical treatments, the medications, the nutritional profile, the vitamins level, and other therapies like low level laser hair therapies are also available. They can help to have like a strengthening of the weak hair. The texture can be improved, the diameter can be improved. But again, the people who had lost the hairline and got like extensive hair loss, and baldness does happen, so that can only be restored by getting like transplantation of hair, right? For example, in stage 1, 2, 3, treatments are really good things. But again, hairline, if somebody is concerned about the hairline, that can only be restored through getting like transplantation of hair. The sides and back hair, usually they're going to be healthy and permanent, and they used to stay there for life. But still, we have like limitation. Three different categories are available of the donor roots, which should be considered before proceeding for hair transplant surgery. That's why proper opinion should be taken from a qualified surgeon, so that we should get the proper recommended method to be followed for your hair restoration. Nowadays, FUE is very popular, and people used to get like transplants, and it's commonly available in the market. It's team-based surgeries, technician-based surgeries mostly, all across the world, basically, right? But first of all, we need to know the sides and back hair normally considered as donor area, but the upper margin of the back and sides does have like non-permanent hair, right? Which are destined to fall in near future, but they can be retained in a better way with the treatments. They can get like prolonged life, and their strength can be improved, and growth can be improved with a good combination of treatments, which includes exosomes, stem cells, low-level laser hair therapies, minoxidil, finasteride, and other vitamins, right? But again, they cannot be stopped forever. This is the treatment is going to be effective until you're using the treatment on a regular basis. The second most important thing, the bottom hair, which are available at the nape of the neck till the ear this goes, they are very thin in diameter and less in number of hair, right? And they can be used commercially to increase our bell to provide you more coverage. But again, they are not the quality which can provide you the better density impact, right? So basically, we have to select the premium donor zone, which is mainly available at the middle part of the central area. Like in the next slide, like we had shown here, okay, the red zone is the zone where the roots are available, but they are destined to fall, and they should not be taken at all as donor, right? Then the orange zone, upper and lower margins does have orange zone as well, and this zone does have roots which are destined to fall, but treatments can prolong a time, limited time for them, right? The moment you are going to stop using treatments, the benefits of the treatment is going to be over, right? So basically, the green zone is the safest and healthiest zone from where we can take the permanent healthiest roots for life, and they're going to provide you the benefit for life. But now this is the most important thing again. The basic theory is the roots which are going to be extracted from the donor zone, they are going to be a cut and paste kind of procedure, right? That means they won't be growing back in the donor area. And the transaction, if the transaction was the safest way in which roots were safely delivered to the recipient area, that means they will grow in the recipient area, right? But importantly, if we are going to take like more graft from the central back zone, which is the healthiest permanent zone, if we are going to extract individual roots one by one, that means if we are going to take like maximum graft count from that green zone, that means you are going to extract uh, the healthiest graft, but on the other side you are going to get like density loss, visible density loss used to happen. So that's why the people used to select the wider area, which doesn't have like healthy roots at all. And the more area, while we are going to select the more area, that means we are going to take the variety of roots, like non-permanent roots are also going to be harvested, and the healthiest roots are going to be harvested, and weak roots are also going to be harvested, right? Number one. Number two, for FUE procedures, we are particularly talking, so the liberty of harvesting from anywhere is possible, but we have to be very precise about the selection of the premium donor area, which is the back of the scalp, which contains like mostly 2 hair roots, 3 hair roots, and 4 hair roots. These are called follicular units or the grafts, right? So basically the cost of per graft is going to be the same for single hair graft, 2 hair graft, 3 hair graft, 4 hair grafts. Commercially, it doesn't matter to us to provide you the maximum graft count with almost you can say like single hair grafts that can help us out to increase our bill. And for the sake of patient satisfaction, a patient can get satisfied by getting like maximum session size like 5,000, 6,000, 7,000 grafts can be taken out in one session by using FUE, but that is not going to be beneficial for life. The more graft count you're going to extract, the more density loss you are going to have in the donor area, number one. Number two, the groupings of hair, by using like micro punches, you are going to cause grouping damages, right, to the roots, right? Because micro punch is going to be used for having like minimal scar, minimal dot scar, which should not be evident with the naked eye. But again, that is going to cause natural grouping loss. Okay, if the root is having like 4 hair follicles into it, but using the micro punch, maybe 1 or 2 follicles can be damaged, and they are going to be damaged forever. They won't be growing back in the donor area, or the root which was able to provide you 4x benefit because of the 4 branches of hair into it, but you got like 50% loss during the blind punching in which you can't see inside the skin, and the roots, the follicles basically got broken, and you are going to get like 50% benefit out of it in one session. And second most important thing is, okay, here is the dead part of the follicle, which you can do like cutting, shaving. That is not going to cause any damage to the roots inside the skin, right? And inside the skin, the part is jelly-like part. It's very soft tissue, and while you got like had shaved off, and now the blind punching was happened, and the roots were been pulled out one by one with the forceps, and you are unable to gauge pressure on it while you're going to pull them out, while you're going to transfer them to the recipient area. In this transaction, roots, lot many roots can cause damages, right? One damage was grouping loss. The second damage was complete loss. Partial damage can cause like texture damage loss. These are the kind of things. And it's very easy to sell and easy to adapt for a patient, okay, because no cut, no stitch is required for this kind of procedure. But again, we should know the roots are just involved in the topical external 2 layers of the skin out of 5 layers, right? So the basic procedure need to be done under local anesthetic, and just the topical 2 layers need to be locally anesthetized. And the pain level for getting like local anesthesia is identically the same. But as far as our specialty is concerned, we are offering 90% pain reduction as compared to normal conventional surgical methods. A lot of people have like bad experiences as far as the pain is concerned while anesthesia they were getting, and even during the session. But we are offering even more than 90% pain reduction as compared to normal conventional methods, surgical methods. And basically, we have to make the integrity of the donor area intact, so that we know, okay, person who's having like baldness as per genetic patterns, so he doesn't require just one session. Transplant requires to be done in the future as well for getting like further density improvement, further surface coverage, because early stage people used to get like transplantation of hair if they got like receding hairline, but ongoing hair loss is still there. The natural hair loss will happen ultimately in the top, and at the time of transplants, we can't remove the non-permanent hair by the time of first transplant. We have to preserve them by advising the hair loss management program, and so that they can avoid getting like further hair loss, they can minimize the possibilities of further hair loss, and can delay or defer the requirement of the further follow-up hair transplant surgeries in the future, right? So that is how we recommend. And secondly, we recommend the safest zone, which does have like permanent permanent hair, and multi-hair roots are there. So we have to extract the maximum graft from there. But if you're going to extract the grafts using FUE, so that means that area can get like a maximum scarring. People are very reluctant to have like scar line, cut line, stitch line there, and that seems odd. Whereas FUE does have thousands of punches or dots, and they are going to leave even bad scarring than FUT scarring. And currently, we don't do independently FUE or independently FUT procedures because people used to abuse the donor area by over harvesting with FUE procedures, or even wide strips can cause wider stretch scar lines. So Dr. Nasser introduced the hybrid FUE with DHI method, in which we can combine both the procedures together, in which we are going to harvest a microstrip from the central back area, which is the richest area, which have multi-hair roots in maximum quantity. They are going to be harvested by a narrow microstrip. Previously, it was like year-to-year kind of strip, and wide strip was been taken, uh, and single layer stitching was there. Latest, we are doing like double layer stitching, in which you can have like finest pen line mark there in the donor area, and that is not going to be evident at all, right? And we are doing trichophytic closure to have like growing hair from the scar line. And the other part, to get like a differential count for topping it up, we are using FUE procedure to top up the count. And that is how we combine both FUT and FUE procedures together. And we are using DHI method to place the grafts into the recipient area. So that is how it works. It is called DHI, FUE, FUT, DHI method. That is called hybrid method basically. And secondly, this is a scar closing. Normally, people were having like wide scars there in the donor area. We are using like trichophytic closure, in which you can have like a growing hair from the scar line. It is going to leave the pen line mark there, and the line is not going to be visible at all with short length of hair. And we are using like limited grafts using FUE method. Then the line and the dots are not going to be that evident, and you're able to donate like healthy grafts in the future. The results of transplantation of hair uh, basically requires like the latest technology, in which we can have like high density transplants. But again, the medical history of yours does matter a lot. If somebody is having like diabetic history, somebody is having like chronic smoking history, so for the safety of the patients, for having like no compromise to the transplanted grafts to take up on the lesser side, we have to have like a patient safety first. And as far as like Hair Club is concerned, we are very particular. We don't treat viral carriers at all. We don't treat uncontrolled diabetic patients. We don't treat uncontrolled blood pressure patients, cardiac patients, or having like some special cases. We have to have like controlled things with us, even through medications, through insulin, through anything. And in special cases, we have to have like medical clearance the from your physicians, basically, right, to create to maintain the safety of the patients on the top priority, right? That is the thing. And the results of transplants, we have to consider the density according to the medical history and clearance, right? For the smokers and diabetic, we have to have like a little reduced density to avoid getting a risk of getting infection or delayed healing, right? So for the sake of safety, we do like a comparatively low density, which normally we can do like highest density for non-diabetic and non-smoker patients. We can put like 50 or even plus grafts at once a square centimeter, whereas for the having like medical conditions, we have to reduce the density for the sake of their health and safety precautions, right? And the results of transplant does vary from patient to patient because of a few different things, like hair caliber, hair diameter plays very important role. With the normal hair diameter, one can expect like normal results, whereas with a thicker diameter of hair, can people can expect like better density impact at once, whereas with a thinner, lesser diameter of hair, finer hair, people should expect lesser density than the normal hair, right? So for thin and fine hair, we always recommend to stack the session into two parts. Okay, in the first session, we have to do like high density, but because of the thin diameter of hair, they can expect like lesser density impact, see-through impact. So we always recommend within 6 months, 4 to 6 months time, they can stack their follow-up session to increase the density to get the similar kind of results which were possible with the normal texture of hair at once. But natural density is almost not possible in one session. But again, illusion transplant purpose is to create a illusion, and illusion is possible in one session because we distribute the grafts in a way in which we can create like high density hairline in the frontal part, so that you should get like avoid see-through impact for the rest of the top, and then the frontal top zone to avoid reflection of the light. Then we have to spread the grafts, decreasing this density for the rest of the top. And using hybrid sessions, we can have like bigger session sizes. We have the capacity of doing like 5,000, 6,000 grafts in one day session, depending. Okay, the requirements are there and the donor health is very good and patient's budget issues are not there, right? These three things are relevant basically. So accordingly, we can do the transplants. And the second most important thing is which causes impact on the results. That is the groupings of hair. Natural groupings of follicles are starting from single hair to four hair grafts. But again, using like method, which method we are going to use, in which how we can ensure the natural groupings to be maintained in the intact form. For this particular thing, FUE does have like blind dissection process in which micro punches are being used, and they're going to be drilled inside the skin by normally technicians, right? And the natural groupings of hair can get lost, right? So that is the main thing. And if you are able to get like four hair graft and you are going to get like just two hair out of it, whereas two grafts were lost during punching, that is a major loss. Almost 50% loss is happening there. So by using FUE, if we are getting like 2,000 grafts and average number of hair is lower with the same numbers, so that is going to create a lesser density impact. Whereas if you got a FUT procedure in which a qualified surgeon is the only person who is going to harvest the donor area from the premium zone, where the groupings of hair are highest available, and they are going to be dissected under magnification because the gap was been closed from the topical two layers, and by using like trichophytic closure, and the roots were been dissected under magnification on the glass top. And we used to take like short length of hair to avoid handling from the live tissues, and that is going to assure the natural groupings of hair by handling the hair shaft without causing damages to the roots, right? So by using FUT, micro FUT grafts, the safety of the grafts is almost 15 to 20% higher than FUE grafts, right? And highest number of hair per root we can achieve this way. And the with the 2,000 grafts, even we are getting like more number of hair per graft. That can be between 2 to 3 hair per root on average. It varies from person to person, but again, the highest number of hair we can achieve with using like micro FUT. That can ensure the density impact on the higher side. And secondly, by opting for hybrid methods, we can have like intact donor area conditions for the future. Like we are not going to cause diffused hair loss all around in the donor area, so that we should be able to get like best quality grafts for the future to have like good density addition and maximum surface coverage in the top as well, right? So that is how we can coordinate and future possibilities. And along with it, we always are very focused. Dr. Nasser always remain focused on better retention of your weak hair. Uh, for this particular thing, we strongly recommend preventive hair loss medications, which includes like minoxidil, finasteride, vitamins, depending upon like health conditions, or even we used to get like complete nutritional and hormonal profile. And after getting like proper assessment, we advise the treatment plans, and which are going to be safe for the patient, and result oriented things are there. People who used to get like follow the treatment plans, they enjoy good density in the top of their non-permanent hair for quite a longer time, and they might defer the need of the follow-up session maybe a couple of years down the road. That is a possibility. And as far as the results are concerned, you must be aware of the things. A lot of celebrities like Noman Ijaz, Nabil, mostly they were used to do like shootings in Turkey, but they opted Dr. Nasser's hair transplant facilities, knowing the matter of fact he is having like a highest qualification in the relevant field, having the best aesthetic sense to create best natural, undetectable natural hairlines, and the strategic distribution is going to be there. And he is very selective about the patients, and he's very particular about delivering the results. I know I've been working for Hair Club from last 25, 26 years, and had seen a lot of patients. Dr. Nasser refused to proceed for the procedures, right? Because of their high expectations and poor donor area conditions, right? So basically, we have to meet. We have to basically first of all examine the situations, age, donor strength, future possibilities of hair loss, and as far as the age of patient is concerned, what kind of expectation he must be having realistically, right? So Hair Club is one-stop shop where we are offering like for like initial stages, we are offering hair loss management program, which can be initiated after having like some necessary nutritional and hormonal profile, and then accordingly the best treatments can be recommended according to the requirements to have like better retention. Mostly people used to come to us for having like a transplantation of hair, but as per need, if they require like just treatments, so we preferably recommend them the treatment plan only, right? If someone have like receding hairline, so then transplant is indicated. Our frontal top is should be the main priority, because the precious donor area should be utilized to create a good natural permanent hairline, so that you must be having healthy hairy look from the frontal top. Then we should address the rest of the top area by getting like follow-up session in the future, and till then they should opt for like the treatment plans to have better retention of their weak hair, and the crown should be managed with the treatments. As far as like other sources are concerned, we are also having like options of doing like a beard hair transplant, beard to head, or the chest to head. But as a matter of fact, 90% of the body hair contains single hair roots. They can be used as fillers for getting like density addition into the already transplanted area. Uh, they does have like different texture and diameter of hair, and that's why we are particular. Okay, they should not be the main source of getting like coverage and density, right? So they just can be used as fillers. Okay, so we were talking about celebrities, and then sportsmen. You had seen Wahab Riaz, Noman Ijaz, Nabil, Wasim Akram got like transplantation of hair. He's our corrector, legendary corrector, and had like his receding hairline and top filling by getting it done by Dr. Nasser and using hybrid with DHI method. And Here are some slides. See, this was the situation he was having. This area was been done with the transplants. Same like Ali Zafar. He's our member since 2000, and he got his matlab, hair loss treatment journey from 2000. And in 2005, he requires his hairline restoration by doing like transplantation of hair, and kept on using treatments. And then second session for hair transplant surgery was been done back in 2009, and by Dr. Nasser Rashid Saab, and this is the result. Ultimately, he's having like permanent growing hair in the frontal part, but top does have like thinning. Noman Ejaz Saab does have receding hairline, and he got a very thin diameter of hair, and he got like multiple sessions for the frontal part, and got matlab, restoration and preventive therapies as well, right? So these are a few cases. Nabil Saab does have like hair loss, and he got like multiple sessions. He got almost like 3 hair transplant sessions with us, and using like preventive therapies as well. Mahmood Aslam Saab does have like hair transplant surgery. Asad Asad Malik Saab does have like a hair transplant surgery from elsewhere, and had a very detectable hairline, sharp line was there, like you can see. Dr. Nasser did his corrective surgery. He softened his hairline by using like finest single hair roots on the frontal edge, and created his temporal regions, which were missing basically, right? So that was the thing. A lot of singers. Mustafa Zahid, he's a singer, and he had like a hair transplant surgery with Dr. Nasser Rashid Saab as well, right? Wahab Riaz does have hair loss. He lost his frontal zone, got like restoration of hair by using hybrid with DHI method. Dr. Nasser treated him, and you can see like excellent results with him, right? And Grant Flower, he's like a cricket coach for a Pakistani cricket coach, batting coach basically, and he got like 2 hybrid sessions with us. He got very thin diameter of hair, less diameter, can provide you less density impact, but still, Alhamdulillah, he got excellent results, right? Shahood Alvi, he had like hair transplant surgery, but later on he opted for like a non-surgical hair replacement for the rest of the top, because of like extensive hair loss in the top. Ahmed Ali Butt, he also went through hair transplant surgery with us back in 2011, right? Lot of celebrities, a lot of names we can't mention here, but still timely, who went for hair transplant surgery in the initial stages. People even can't recognize whether they got like transplantation of hair or not, right? But still, our major exclusivity is absolutely undetectable natural hairline. Here are some YouTubers like Zubair Rayaz. He's a famous YouTuber and a vlogger. He got his hairline done, frontal transplant done with us. Dr. Nasser Rashid updated his hair transplant surgery, and even Abdul Malik Farid, he had like receding hairline. He was like this before. He went through hair transplant surgery with Dr. Nasser Rashid Saab using the hybrid method, hybrid with DHI technology. And a lot of other common people went through like hair transplant surgery with us, right? So basically, as far as like a hair club is concerned, so hair club is doing like best recommended treatment, especially for those who are having like limited hair loss. They are a good candidate for getting like transplants. The people who got like extensive hair loss, we recommend them if their expectations are quite high and they want to get like full thickness for all around, and they don't want to undergo for a surgical process, they can opt for non-surgical hair replacement. Faisal Qureshi is our member. Zahid Ahmed got his hair transplant, 2 hair transplant surgeries done from elsewhere, but He was not satisfied with the kind of density he was getting. So ultimately, he became our member and got like non-surgical hair replacement. We are offering like latest options, top-notch products available with us for non-surgical hair replacement as well, which are even so natural, undetectable. Even backcombing can not shows okay, whether you're having like natural growing hair or the non-growing hair you're using, right? And they're the kind of services, and we do like combinations of things as well. Okay, we are doing like a transplantation of hair for the hairline, and for the rest of the top with the non-surgical hair replacement, that is called combination. That is advisable for those who are having like extensive hair loss in young age and wants to get like full thick set of hair without any detectability. Non-surgical they don't want to use because of detectable looks, thickness, unnatural thickness or artificial looks. So we do combination in which we do like transplant for hairline, and for the rest of the top we do like non-surgical hair replacement as well. This is called combination, and that's going to be the best way to have like full thickness and full coverage. Uh, these are a few things. I would like
Okay.
to call Dr. Nasser now. Thank you very much,
Okay,
sir.
now we will move to the main topic, which is exosomes. Before giving a detailed briefing or information on exosome, it was very important that all the attendees should understand about the hair transplant and any therapy which is available nowadays, whether it's hair transplant surgery or whether it's exosomes or whether it's PRP or oral medications like finasteride, Propecia, minoxidil, Regain. Everything has its minimal role. No procedure or no treatment is like a miracle solution for the baldness, because it is a chronic disease and your hair loss is going to progress every year. It is getting bigger and bigger and bigger if you have even mild history in your family from your grandparents, maternal or paternal side. So, first of all, the main reason of this webinar is to create awareness that it's not like going to the market and buying apples and buying milk and just doing your grocery and coming back. It is a scientific, it is a medical disease which needs to be diagnosed first, and there should be medical treatments to make your leftover hair healthy before going for any kind of therapy or surgery. So this is one thing which is missing. We have noted in the past 5 to 10 years that even the patients and the doctors, and sometimes a lot of doctors, they just go for either PRP or exosome, or they just want hair transplant, and nobody gives time or nobody gives consideration to the fact that there should be some history taking, there should be some diagnosis, what is happening. Even if it's a male pattern baldness, even if it's genetic in your family, you have inherited it from your father or your grandfather, still there are issues which need to be addressed, because we have seen in the past 5 to 10 years that patients' donor areas are also getting thin, which should not be the case in male pattern baldness. That's why it is called male pattern baldness, because the hair loss occurs in a specific design, in a specific pattern. In male pattern hair loss, which is genetic, you don't lose hair from the back, upper side of the neck. You don't lose hair from the areas above the ear. You only lose hair from the frontal hairline area. You lose hair from the top, and you lose hair from your crown area, which is the small circle visible from the back side. So, but your hair in the temporal regions, which temporal region is the area which is just above the sideburns and above the ears, and the occipital region, which is the area just above the back of the neck, these areas don't experience any kind of hair loss. And genetically, in male pattern baldness, these areas are not destined to go bald or suffer hair loss. But in the last 5 to 10 years, we have seen patients who are even losing hair from their donor area, which is supposed to be permanent. But in practical studies and in research that we did in 5 to 10 years, it has come to our notice that a lot of hair patients who have undergone hair transplant, they are also having hair loss in their permanent donor area, which is not right, which is not healthy. So before going for any surgical procedure, I think it is very important that you should get your lab test done for basic vitamins, minerals, and nutrients that are needed for good health of hair, for slowing down hair loss. So this is a lapse. This is a missing step that is actually responsibility of both the patient and the doctor. And this step is being many times missed by the doctor even. They are not getting the test done before doing the surgery. And what happens is that if besides the male pattern baldness that you have inherited, you are undergoing a genetic kind of hair loss. Uh, Besides that, if you have some deficiencies also of minerals and vitamins, so you will lose more hair and you will experience more aggressive hair loss. Or otherwise, if that kind of deficiency of any vitamin or any deficiency of mineral, it is not diagnosed or it is not treated, then you start having hair loss in your permanent donor area also. So this is very important, because if if your donor area is getting thin, and if you are having hair loss in your donor area, then a certain part of the transplanted hair would also not be permanent. So this is very important that before you undergo surgery, you should always get your blood test for important vitamins and minerals which are needed for good health of hair. You should always get them tested and checked by a competent doctor, so that if there is any deficiency, it can be corrected and your transplanted hair get maximum life. Otherwise, if there is vitamin deficiency, vitamin B12, vitamin D, or any hormonal imbalance, or any mineral like iron or magnesium or zinc is deficient in your body, then even over a period of 5 to 10 years, your transplanted hair can also get thin, and your donor area can also have hair loss, and donor area can get thin. And what happens is, if your donor area gets thin, then in future, if you need more hair transplant, then your production of the donor grafts might not be as much as it would had been if you had been treated properly for any deficiency. Because if the density in the donor area decreases in the second or third surgery, the count of the hair or the count of the donor grafts or the hair roots that would be available for transplant would their number would reduce drastically down, and you might not be able to get a high quantity of hair because of thin donor area. So this is very important. So all this talk we have done is because these therapies like PRP and exosomes and stem cells, they actually rejuvenate and regenerate your damaged hair follicles or weak hair follicles. They make them stronger, and they help them uh, in producing a more longer and more thicker hair. And sometimes they can also regrow lost hair to certain extent, but more of their benefit is for prevention and for increasing the quality of existing hair. If the skin has gone totally shiny bald, then these therapies might not work. They will work in an area where the hair diameter or the hair quality is poor, but there are still some hair which we call baby hair. But if there is no baby hair in an area and some part of the head has gone that bald that it is shiny, it is absolutely hairless, there is no fine hair or baby hairs present, then in that case, first, these kinds of areas, you need a hair transplant. It is better not to waste time and money on false hopes of getting stem cells and exosomes for absolutely bald area. These therapies are not for absolutely bald area. They are for areas where there are still some percentage, even if you have lost 90%, but there is still some 5 to 10, 15% hair, although they are very fine, but there are hair. So such area which has very weak or fine hair, they are the targets for exosome therapy. And normally, exosomes are also done in the donor area to make its quality, um to improve the quality of hair health in the donor area before transplant. Because, as I told you, a lot of people nowadays who are coming, even in young age, their donor area is not as healthy as they used to be 10 years ago. So, a lot of people are not only having the male pattern baldness from the front and the top, but they are also having hair loss in their donor area above the ears and above the neck, which from where we have to take the hair roots for transplant. So this is very important that you get your basic and essential blood tests done, which are needed to check the health of your hair. And before you undergo surgery, or before even you plan for surgery, you should get these tests done. And sometimes, or most of the times, in patients which have thinning donor area, or the donor area density is not as healthy as it used to be or as it should be, then we recommend these treatments like exosomes in the donor area before doing the hair transplant. So the exosome therapy has two uses. Number one, in younger patients who are not candidates for hair transplant, or whose hair loss is not that big that they need a hair transplant, they can undergo exosome treatment for a couple of years, which can delay the ultimate balding look, but it cannot 100% stop hair loss. And it is not a one time treatment. You might need two or three treatments in 1 year for excellent result. So if you are not you are not planning a follow up treatment of exosome, then one session result might only last for around 3 to 4 months, not more than that. So you should keep in mind that any kind of hair loss therapy, or hair regeneration therapy, or anti-aging therapy, or any regenerative technology, it might need to be repeated once or twice or thrice a year. So it as Azhar has already told you, that hair loss, especially the male pattern hair loss, which happens in men and males, it is a chronic disease like blood pressure and sugar and diabetes. And you can treat this disease, but you cannot cure it. There is no cure, but there are treatments. So what is the difference between a cure and a treatment? A cure is something like in which you take medicine only once in lifetime, and your disease is cured. Just like malaria, you take anti-malarial drug, and then you are cured of malaria. You don't need to take any medicine on regular daily basis. But a chronic disease, for example, diabetes or blood pressure or asthma, so these are the chronic diseases in which you need to take medicine on regular basis. So similarly, male pattern baldness, especially in men, it is a chronic disease and it is not curable, but it is highly treatable now with new technologies. And being treatable means that it's not gonna be a one time therapy or one session. There's nothing like that. It is a false promise if somebody is saying that you will only need one session and it would be good for your whole life. There is nothing like that. It's a false belief. It is wrong statement, and it is giving somebody false hope. It is absolutely incorrect and false. So always keep in mind that when you are getting any medical treatment, or any regenerative therapy, or any rejuvenative therapy for hair loss, it is not a one time therapy. It might need multiple sessions over a period of 1 to 2 years or 3 years. So the frequency of sessions can vary in some patients. Some patients with very aggressive or very poor hair health, they might need more sessions in a year, and somebody with good health of hair, they might need less sessions in a year. So for exosome therapy, which is under discussion, a patient to patient, it can vary. Some patients might need only one session in a year, and some patients might need two sessions in a year. And there can be a lot of percentage of patients which might need three sessions in 1 year, and a small percentage of patients might need four sessions in 1 year. So this is a very important information that you need to keep in mind, that it is a multiple session treatment or therapy, and it is not a one time therapy. And you need to have a basic diagnosis, and you need to have a checkup before undergoing any kind of treatment, whether it's PRP, whether it's exosomes, whether it's hair transplant, it needs a thorough assessment. And for that, it is highly recommended that you get a personalized um, assessment and checkup of your hair loss of your head, which includes the assessment of your donor area, and which also includes the assessment of your recipient area, and then it also includes the assessment of your general health, your nutritional status, what kind of nutrition you have, and there might be a need to get some blood tests done, which we just write it down for you, and you can get it done from your hospital or from any good lab. Then you can get those tests checked by us. So this is how it moves. It's like non standard clinics, or clinics which are not recognized internationally, who don't have the qualifications, who are not affiliated with standards control authority, or like they don't have any SOPs in place. So they just do these therapies without making any diagnosis, without checking any blood tests. So it is not a good practice, and neither the patient should get it done, and neither the doctor should just immediately do the treatment without taking out thorough medical history of the patient. And if there is any doubt, and there is a need for getting some blood tests done, those must be done. uh, you can get those tests done even after the treatment also, but they need to be done within 1 month of the treatment, so that the reports are available, and if there are any deficiencies, you can be prescribed vitamin and minerals and supplements to correct those deficiencies, so that the result of the therapy of exosome therapy or PRP therapy or any other hair loss treatment therapy, its results are optimized, and results are in the upper grade, like from moderate to good results. Because if there is any underlying deficiency which is affecting your hair loss, then these regenerative therapies might not be as effective as in a person whose vitamin and minerals and hormonal levels are in perfect order. So, Azhar, you would like to add something relating to this exosome topic, which I might have missed?
Basically, most of the things are clear, and combination therapies would always be the best option, because one therapy is going to be beneficial. Certain percentage can be achievable by the single therapy, but the best results can be taken with a good combination of treatments, and consistency is really important to have like excellent results.
Yeah,
Otherwise, the benefits.
very right. I would like to add that it's a holistic 360-degree approach. It's not something that you just get one exosome and then you are just uh, ignorant about regular nutritional good nutritional habits or good lifestyle, or good supplementation, or you are not vigilant about checking the blood levels of essential vitamins and minerals. So it's like a 360-degree approach. When you're treating hair loss, you need to be very patient, and you need to be very dedicated, and you need to be very vigilant about multiple aspects which can increase the rate of hair loss. So the point that we are trying to make is that it is not a one treatment or a one technology uh, prescription. It might have some oral medications, it might have some topical medications, it might have some minerals, you might have to take some vitamins, and then with all that in place, then these regenerative therapies like stem cells and exosomes, their results are much better compared to somebody who is not treating the hair loss in a bigger picture as a holistic approach, and he's just focused on one treatment, that I will just get hair transplant, or I will just get exosomes, I don't want to use any medicine, I don't want to get any blood test done. This is a very wrong and illiterate approach. If you want to have sustainable good results from any medical treatment or any regenerative therapy for hair loss, then you need to take it as on a bigger picture level. You need to you need to assess your vitamin levels, you need to make sure your hormones are okay, you need to make sure your mineral levels are okay, you need to make sure your lifestyle is healthy, you need to make sure your sleep pattern is okay, you are not deficient of sleep, and your dietary habits are okay, your sugar intake or your you know, unhealthy food intake is not beyond limits. So it is basically, you should understand that hair and skin, there are two organs of the body which actually reflect your inner health. So they sometimes you have problems in your other organs or inside your body which are showing in form of symptoms on your skin and hair. So it might not be a local problem with your hair follicle, it might be a systemic, much bigger problem in your blood. Like in females, the most common cause of hair loss which goes undetected is the deficiency of iron. And you cannot diagnose iron by just getting the blood iron level. You need 4 or 5 tests to establish that whether there is iron deficiency and what kind of grade of iron deficiency the patient has. It is mild, moderate, or it is very aggressive or very high deficiency. So these are the things that the doctor should also know before prescribing any hair transplant or exosome. And these assessments should be done uh, um, in detail so that the patient can get good results from regenerative and restorative procedures. So if you guys have any question regarding exosomes or regarding exosome treatment cost or regarding different types of exosomes, as I have discussed, plant-based, animal-based, and these the new technology, metacell technology, MCT, which uses your own blood to extract your own exosomes, which are not foreign body. So if you have any questions, you can post in the chat window, and we will be more than happy to answer them. So other, you can take some time to explain some other products that we offer, like the medical treatments and the PRP, and some information about the costing, and especially the promo offer that we are doing for this week in London, Birmingham, and Manchester. um, uh, Kindly, just very shortly and in a very short time, kindly, convey all this critical information to the attendees.
Yes, sure, sir. Thank you very much. Basically, first of all, the questions you must be sharing in the text form so that we can get back to you with the relevant details. And as far as like current promotion, currently in this trip, we are offering MCT exosomes, meta cell technology, autologous exosomes, which are driven from your own blood, which is commonly available in UK for about 600 to 900 pounds per session. So we are offering a special package for the resident, Pakistani resident in UK, for like a single session for 450 pounds. Whereas if they are interested for getting like multiple sessions, and as per recommendation of Dr. Sahab, so we can offer like 3 sessions for just 1200 pounds. 3 sessions for just 1200 pounds, of which we have to make the payment plan in a way, okay, 50% payment at the first procedure cost should be paid, like 600 pounds should be paid for the first time, and 300 for the follow-up sessions. And these sessions are going to be conducted in UK quarterly, every 3 to 4 monthly. We can align your appointments there in UK and can have the procedures, right? Secondly, the appointment schedule, basically we are conducting like exosome sessions. Limited slots are available for 24th and 25th in the UK, London, right? And then we are having like next appointments for Birmingham, and for 2 days, and then we are having like appointment in Manchester for 2 days, and one day again is available in London again on 31st of uh, July. These are the appointments, and we are offering like special discounts for the students, and we need to have like their identity, student identity is required, and they are going to be offered a special discounted cost for the exosomes as well. And second most important thing for getting like transplantation of hair, people who are interested for getting like transplantation of hair. So normally in Pakistan we are charging 1 million rupees per session for Dr. Nasser, but for this particular time we are offering special discounts. Okay, we are just offering 2,000 pound for a basic session of 2,500 to 3,000 roots, right? With Dr. Nasser, just for 2,000 pounds. And if somebody is looking for getting like extensive session size with higher number of grafts, so then the cost is going to be up till 3,000 pounds, 2,500 to 3,000 pounds, depending upon session size. Whereas, as far as the associate hair transplant surgeons are concerned, a lot of other surgeries, Dr. Nasser's trained associate surgeons they're doing with the team. So that is also possible for 1,000 pounds to 1,500 pounds. Basically, 1,000 pound is the standard session size in which we are doing transplants from 2,500 to 3,000 grafts. But again, if somebody is looking for getting like extensive session size, the one can opt for even a higher cost. Maybe 1,500 pounds can be the cost. For premium patients who are going to get like booking with Dr. Nasser, uh, we can offer like airport to hotel and hotel to clinic pick and drop facilities. Same like for the backwards, and one night stay for in a four-star hotel, especially in Lahore. Okay, so that is the possibility we can do that with a package. No extra cost is going to be there, but necessary lab investigations have to be done uh, well before time. Better to get it done from UK if conveniently possible. Otherwise, take time, and we always can book like appointments for hair transplant surgery in Lahore with advance notice. At least 4 to 6 weeks notice is required to have the preferred appointments with Dr. Nasser and even with associates, right? So that we can set you on priority basis. And as far as some people does have query whether the transplantation of hair is possible in UK, London. Yes, that is possible, but again the cost is going to be at least 4 times higher than getting it done from Pakistan, right? The Basically, if you belongs to Pakistan and used to visit Pakistan, so always it's a better option to line up your appointments in Pakistan with us, and Lahore is going to be the main office where we can line up your appointments, right? So that is a possibility. And we are also offering very few seats are available for like PRP sessions as well. It's a low budget procedure. In UK, average cost per session is going to be 250 to 400 pounds per session is the cost. But here, with this particular visit of Dr. Nasser here, we are offering that PRP session just for 150 pounds, right? That is possible. And the people who are particularly interested in having like a one-to-one physical consultation and physical assessment session with Dr. Nasser. So we are offering like paid consultations normally, and we are charging like 100 pounds for the consultation fee, which is 100% adjustable in the treatment cost. If somebody is looking for getting like even simply PRP session, so normally cost the discounted cost we are offering for PRP session is 150 pounds. But 100 pounds for consultation is going to be 100% adjustable in the procedure cost. Means 50 pounds are required to be paid further apart from like 100 pounds of the consultation fee. Secondly, the exosomes, and same like if somebody is interested for getting like transplantation of hair and would like to get like booking for it, So this special discounted cost is valid till 25th of July for UK London patients, and they have to make like apart from £100 consultation, physical consultation, they have to make like another £400. Means we require £500 in advance to offer you the same discounted package which we are offering at the moment here, right? So, anything else you'd like to know, so do let us know. We are more than happy to uh, respond and help you out.
Okay, thank you, Azhar. Uh,
Sir.
the exosome treatment, there are some questions. I would like to answer those questions which have been posted in the chat window. One is that how much you charge for the DHI. So Azhar has already explained that my associate surgeons, if the surgery is being done by the associate team, then the average cost is gonna be between £1,000 to £1,500. If it's an average session between 2,500 to 3,500 for grafts, which is equivalent to around 7-8,000 here, then it's going to be around £1,000 with the associate surgeons of Hair Club. But if the same surgery is being done by me, then it's going to cost between 2,000 to £2,500. But if the surgery scope is bigger, like 4 to 5,000 grafts, then with the associates, it's going to cost £1,500. And the same surgery, if I'm going to do it, it's going to cost £3,000. Yes, we have clinic in Lahore, and the surgeries that I do in Lahore, and sometimes I also do in Islamabad. Exosome therapy is available in London, Birmingham, and Manchester from tomorrow till 2nd of August, 1st of August. So for tomorrow and day after tomorrow, 24th and 25th, we are offering exosomes in London. And then on 26th and 27th, we are offering exosome therapy in Birmingham. And on 29th and 30th, we are offering exosomes treatment in Manchester. And we might have some slots available for London again on 31st of August, July. So these are the dates. And there is another question. The concentration for the MCT exosomes, I have already told you, it depends on the concentration of your platelets. So for people who have higher platelet concentration in their CBC, the concentration can be as high as 250 billion to 300 billion. But persons or patients who have a little lower concentration of platelets in their blood, in their CBC, like 1 lakh to 1 lakh 50,000, then the concentration still is going to be 200 billion, which is almost double than the normal commercial preparation, which is coming from plant or animal source. Because the highest that is available is 100 billion in the plant and animal source exosome. There's a patient who has written that he has got first session from Turkey and now he wants to get another session. I would suggest that you note down the dates. I don't know where you are located. You haven't mentioned that whether you are from London or Birmingham or Manchester or anything nearby. So we are here in London on 24th and 5th. If you are nearby, you can come for a consultation and physical assessment for like half an hour. And that would be the best way to get the information, because you have already got another first session done in Turkey. So we need to have a thorough examination of your donor area and of your scalp area and bald area. And then we will discuss it out with you and we will explain to you all the possibilities and options that are available for you for the second session. So it would be best that you come in for a physical consultation and physical examination. And you can come to London, you can come to Birmingham, you can come to Manchester, whichever city suits you. So dates, I will repeat again. The London dates are 24, 25. The Birmingham dates are 26, 27. And Manchester dates are 29 and 30.
Great.
In London, our location for the therapy is in Chelsea. We can share, you can text us on the WhatsApp and we will share the address and the location and the local phone number. So just send us in a WhatsApp on our UK WhatsApp number and we will share all the details for London, Birmingham and Manchester. Yes, you can have a one-to-one consultation with me. You can text on the WhatsApp about your name and in which city you want the consultation. You want in London, again, you want in Birmingham, or you want in Manchester. Just let us know about your city and we will book a one-to-one consultation for you through the WhatsApp. Yeah, okay. Sorry, I missed that you have written it for London. So please note that if you want a one-to-one consultation in London, it will only be tomorrow and day after tomorrow, like 24th and 25th. After that, the dates would be in Birmingham and Manchester. So you can take appointment. You can text right now, or you can text in the morning. Just leave a message on the WhatsApp number, and our team will schedule your appointment either for tomorrow or day after tomorrow. Any other questions? If you have any other question, please post in the chat window. Ajay, do you want to show the Numanja's question answer session video? Can you play it?
Sir, currently I won't be able.
Okay. Is there any other media or
Or
content you want to share?
currently, we had shown the basic things, but
Okay.
again, right?
Yeah, online consultation is also available. You can have an online one-to-one consultation, and it is even at 50% discount. It's just £50, and you can have an online consultation. And after the online consultation, if you feel like you want to get a physical checkup, you can convert the online consultation into a physical consultation also by paying £50 extra, and you can do it. The prices, we have already told you that the online consultation is £50, and you can convert an online consultation into a physical examination if it is required by paying an additional £50, or the one-to-one private in-person consultation at our location with Dr. Nasir is £100, but that is not a consultation fee. It is a deposit which is 100% adjustable in either exosome therapy cost or in your hair transplant advance. So that would be 100% adjusted. But the £50 fees is not adjustable. It is a consultation charge, so it won't be adjustable. Yes, we can give you consultation for hair thinning and for dandruff and everything, but for that you need to come in for a physical checkup. That cannot be done on online system. Online, we can just give you basic assessment. I can give you, I can answer your questions. I can see your scalp. I can see your video. But for any kind of problem of the scalp, like dandruff or hair loss or receding hair, I think it is better that you come in for a one-to-one consultation, so that we can examine your hair, we can examine the balding area, we can examine the donor area. The timings for tomorrow and Saturday, they are going to be between 8 p.m. till 10 p.m. And we have some slots available in the morning also. You just send us a text on the WhatsApp and your preferred time slot. In the morning, it's going to be from 9 to 11 a.m. 9 a.m. to 11 a.m. in the morning, and then 8 p.m. till 10 p.m. in the evening. So these are the timings for London on 24th and 25th. So the best for micro details is that you send a WhatsApp text, and our team will give you all the micro details and timings and everything, and location and address and phone number and costings, everything. It is better that you send a detailed text, whatever information you want. Just share it on the WhatsApp with our team, and they will give you all, they will answer all your questions. Because the webinar is basically a little bit a brief summary. It's not a very detailed, information session. It cannot be a very detailed information session in which we can, handle individual queries. It is basically a generalized information session. So, but our team is available, and they will be more than happy to help you with your customized questions, or your specific situation might need specific answering, which is not for everybody's benefit. So it is better to contact us on WhatsApp. You can give us a WhatsApp call also, or you can leave a text or an audio message, and our team will be replying you. Any other question? Azhar?
Yes, sir.
आप काइंडली चैट विंडो में लंदन की डेट्स, बर्मिंघम की डेट्स, मैनचेस्टर की डेट्स डाल दो, और ये जो 50 पाउंड्स और 100 पाउंड्स वाले फॉर्मूला है, जो 100 पाउंड एडजस्टेबल है, काइंडली ये भी डॉक्यूमेंटेड उसमें कर दो, ताकि ऑल द अटेंडीज कैन टेक स्क्रीनशॉट्स, और अगर किसी की कंफ्यूजन है तो दे कैन रीड इन रिटन फॉर्म, दे कैन गेट अ रिटन all the details in written form. Just put in the dates for
जी
London
बिल्कुल
24, 25, and dates for Birmingham 26, 27, and dates for Manchester 29 and 30.
बिल्कुल ठीक है सर, I'm putting that there.
Right, and the one-to-one physical consultation, basically it's not a consultation fee. The consultation is absolutely free. The $100 is a deposit which is adjustable in the exosome treatment cost or hair transplant cost. But if you are taking an online consultation, then it's a £50 charge, which is non-refundable and non-adjustable.
Great.
But you can always convert an online consultation into a physical consultation by paying another £50, and then it would become adjustable in the exosome or PRP or hair transplant cost. So just write these few brief points for the audience, and tell the call center staff that they also share it to all the incoming WhatsApp numbers that they have received queries in the last 2 days.
Great, sir. Definitely.
So if there are no more
We'll do the
questions,
needful.
we might conclude it, as it is already, we are beyond the scheduled time. We were supposed to have a 1 hour seminar, although we started late, for which we offer apologies that it was a 15-minute delay, because a lot of people were joining at that time, and we didn't wanted to start the seminar unless all the people who are in the process of joining. So our apologies, and it was for the delay was for the overall good of all the attendees, so that maximum persons can take the information. So we started the webinar at 9:20 even. Still, we are pretty late. We are already 25 minutes above the scheduled time. So if there are no more questions, we will end the seminar. And if there is any unanswered question left of the attendees, feel free to send a text on the WhatsApp numbers. Other kindly WhatsApp numbers भी post कर दें आप chat के अंदर.
श्योर सर, मैं कर देता हूँ बिल्कुल.
हाँ, यूके का पोस्ट जो व्हाट्सएप, दोनों व्हाट्सएप नंबर 912 एंड 914 पोस्ट कर दें.
श्योर, मैं कर रहा हूँ
और
सर.
बर्मिंघम की डेट्स भी पोस्ट कर दें, मैनचेस्टर की डेट्स भी पोस्ट कर दें, और फोन नंबर्स पोस्ट कर
बिल्कुल.
दें, ताकि कोई भी इंफॉर्मेशन किसी ने और लेनी है, जिसके पास अगर व्हाट्सएप नंबर मिस हो गया है, उसने सेव नहीं किया, तो वो हमें व्हाट्सएप के ऊपर डिटेल्ड क्वेश्चंस भेज दे.
जी सर.
जी, the recording, there is a last question. The recording of this webinar, we will post it on our Facebook, and we will upload it on our YouTube channel, and you will also get a link in your email. So we will send an email to all of you who are attending this webinar. We will share a link of the recording of this webinar in the email. So you can check your email after 2 days, and inshallah you will be having a recording link, and you can click that link and download the audio file of this webinar if you want to listen it again.
जी सर, ये डेट्स हमारी हैं 24-25 जुलाई की फॉर
For
लंदन,
London, it's 24,
और
25. For Birmingham, it's 26, 27. For Manchester, it is 29 and 30.
29th and 30th.
Yes.
29th and 30th. Yes, done.
And we might be holding, it's not confirmed, but we will confirm it later on. We might be holding a one-to-one consultation session in Glasgow on 31st or 1st, but we will announce it afterwards if it has been arranged. So far, it is 50-50 chances, but there are more than 50% chances that we will be holding a one-to-one consultation session in Glasgow also.
Great. We would mention it.
Yeah. So we will confirm it in a day or two, that whether we are going to Glasgow or not. So I would be leaving the webinar on for a few more minutes, so that people can take screenshot of the chat window. Because if I will end the webinar, the chat information might be lost. But I am leaving the webinar now. but the webinar will remain open for another 10 minutes for anyone to note down the WhatsApp numbers and note down the dates and locations. So I am really thankful for all the attendees, and we welcome you for any more queries through WhatsApp. Or if you want to have an online personal one-to-one consultation, you can also send the request on the WhatsApp. So see you guys again, inshallah, very soon. Allah Hafiz.
Allah Hafiz, sir. Thank you very much. G, any other information?